specific to travel to Washington State from countries reporting the circulation of a new variety, a new variation of the coronavirus, which includes travel from the United Kingdom and South Africa. This proclamation will require travelers who've been in those regions in the last 14 days to quarantine for 14 days upon their arrival in Washington State. And this includes passengers who may have arrived here just in the last few days. The only exception to this requirement will be for flight crews, although we're currently looking into that concern and ways to address that with some additional testing in this regard. This proclamation, of course, is in response to news out of the United Kingdom and South Africa and other countries of a mutated version of the COVID-19 that is circulating there. And as we find more nations that apply to this proclamation, we'll update that list online through the Department of Health. This is a cautionary reminder that we're perhaps months away from being out of the worst of this pandemic, obviously. And it is a vivid reminder of the uncertainties and unpredictabilities of this pandemic. And I think a compelling reason to continue to adhere to what we know reduces transmission, meaning the use of masks, social distancing, limiting travel, and avoiding in-person gatherings, particularly indoors. The key concern out of the United Kingdom is that officials there say that the most common COVID-19 strain in circulation has mutations that may be causing it to spread faster than other strains of COVID-19. They have not concluded, this is important to say, they have not concluded that this strain is more deadly or vaccine resistant. Our state epidemiologist, Dr. Scott Lindquist, at the Department of Health, will have more to say about that shortly. So today's action is a common sense public health measure in response to developments in Europe, and it is another attempt to keep Washingtonians safe from this potentially fatal disease. Now, there has been good news, obviously, in the last few days on this front, with a second COVID vaccine now been authorized. Congress is working to pass another relief package as we speak. So there are very tangible reasons for hope, even though we all know that there's still much work to do in this regard. So we're getting closer to that happy day, but we're still trying to get closer to rounding the corner. Obviously, we're not there yet. Our current COVID-19 data still suggests we're not going to see a post-Thanksgiving spike, fortunately, like other states have seen, so that's good news. However, this means we need to do the same things we did to avoid that Thanksgiving acceleration if we don't want to end up like those other states that are seeing horrific rates of acceleration, both in their infections and their losses of life. So that does mean we need to continue to avoid indoor gatherings. And certainly during the holiday season coming up, that's of particular importance. So Santa will be perfectly safe coming down the chimney to be indoors, but we really hope people avoid others being in a household this holiday season. We can find ways to enjoy our loved ones in other ways. Outdoors works as well. So the good news, things do not appear to be accelerating the way they were in Washington. But our situation remains very tenuous. How and when we come out of this pandemic remains determined in part by adhering to COVID-19 health protocols and making responsible personal decisions. But what we're announcing today is to try to reduce the rate of infection coming from these other countries, which will work in parallel with our own individual efforts to keep our families and our loved ones safe this holiday season. Fortunately, we have tremendous talent in this regard in the state of Washington, including Dr. Trevor Bedford from the Fred Hutchinson Center, Associate Professor of Vaccine and Infectious Diseases. And I've asked him to talk a little bit about the information coming out of the United Kingdom. Dr. Bedford, thank you for joining us and being on the job so quickly. Dr. Bedford.
Thank you, Governor Inslee. So I just wanted to make a couple brief remarks about the science behind this. So there are two main things that I think that are going on here that are important. So one is if you look at this variant's genomic sequence, the virus genome, there are some mutations that by themselves look biologically interesting, look relevant, look important, that just from seeing those mutations in the sequence, you'd think that they could change the function of the virus to some degree. However, and some of those mutations have been characterized independently in the lab and shown to have effect, but they haven't all been put together and characterized in the lab altogether at this point. Virologists in the UK are working on this now. And so we have a variant that just from the sequence looks perhaps a little bit different than what's been circulating. And then that's connected with that if you look in London in the past several weeks, that this variant has been rapidly increasing in frequency. So it first emerged in late September and is now the predominant virus that's circulating in London. So most recent tests are finding this virus, this variant this last week. That is entirely where the 70% more transmissible figure comes from. They haven't done contact tracing or kind of this detailed work. Instead, it's by looking at the prevalence of what was circulating and then seeing that this new variant is rapidly becoming predominant. And that's entirely where the 70% comes from. So we don't yet know. It seems very likely to me, but not certain, not at all certain, that it is more transmissible, but we don't know the mechanism for that. It could be that it is more intrinsically infectious. It could have a longer pre-symptomatic period. It could be milder and have a more asymptomatic transmission. There's a lot of ways you could accomplish this that are not just pure infectivity. However, they have seen that there's higher viral load in individuals that have this variant, suggesting, again, there's some kind of biological plausibility behind this. So I think that it is smart to be looking for this and to be trying to limit exposure to this variant at this point. The US has its own sequencing like the UK does, not to quite the degree. And looking at the data that I've been doing carefully, we haven't seen any of this variant in the United States at the moment, but we can't say for sure that it's not here given the levels of sequencing that we're doing.
Governor, you are muted. Governor, your computer is muted.
How's that, Josie?
Sounds great.
Great. By the way, let me note that the governor did not mute himself. I know others would like to, but there's some strange software here muting the governor. No, what I was saying is that we want to prevent or reduce the prospects of this. The UK is having to impose very significant restrictions now because of the explosion of COVID associated apparently with the growth, the very rapid growth of this particular mutation. So we believe this is a reasonable approach, and we're asking folks to be safe and abide by this quarantine if they do come. We now want to stay in comments with our state epidemiologist, Dr. Lindquist, who we appreciate working with communities across the state of Washington for the last few months to keep them safe. Dr. Lindquist, your comments, please.
Yeah, thank you, Governor. So what I want is to be clear what this means for the public health system here in Washington State. So as you can see, we have this great relationship with such an asset in Washington State with Dr. Bedford. That will continue. So we plan on being very vigilant, looking for this strain here in Washington State. But to be very clear, we want people to quarantine if they've traveled to any of these spaces that we talked about. And again, all things apply during this Christmas and holiday season is if you become ill with fever, cough, shortness of breath, any of the symptoms of COVID, we want you to be tested. So clearly, anyone who has traveled from any of these countries that we are identifying, and more to come for sure, we will encourage you to get tested so we can make sure that you don't have this new novel strain. And again, the public health system is pretty clear. We are being conservative by doing this travel restriction. This is not a mandate or a ban on travel, but we are very clearly encouraging people to get tested, to do quarantine for 14 days until we have a better understanding of this virus worldwide and here in Washington State.
Thank you, Doctor. And I do want to make sure that people do understand this is a legal requirement to quarantine. It is not simply a recommendation. We obviously want people to voluntarily comply, but it is a legal requirement by directive of the proclamation of the governor pursuant to our emergency powers. It is a request for those folks also to be tested, in part because that helps us monitor the progression of the disease, even if people are asymptomatic. So we believe this has a reasonable chance of slowing the spread of a mutation that we know is causing chaos in the United Kingdom right now. So we are hopeful that this will be one more tool that has helped Washington have relative degree of success. It is because we have been responsible, because we have acted early, and because we have acted based on science. And having Dr. Bedford, Dr. Lindquist, and others, John Weisman, Kathy Lofi, we've been able to make early decisions that have kept us having a lower infection rate than perhaps 45 other states. We'd like to keep it that way. So I look forward to your questions. I will only be able to take questions on this subject today, but with that, look forward to your questions.
Great. For the Q&A portion, reporters, please unmute yourself when called upon to ask your question. First question comes from David with the Seattle Times.
Hi, Governor. Is there any enforcement mechanism or any enforcement planned for this? Are you going to follow up with people who arrive at the airport? And do you have an estimate on how long this order will be in effect?
Well, there is a possibility, certainly in the contact tracing of our effort, to be in contact with people. We don't have the logistical ability to take people into custody, so that's not going to be the case. But we have found that these proclamations do have a positive benefit because people want to, A, abide by the law, by and large, or the vast majority of people, and number two, they want to save lives. And this is a message to save your life and save the life of your loved ones. It may mean you don't visit indoors particularly or otherwise to meet this quarantine requirement, but it means you might save your loved one's life and the larger community in the state of Washington, because we know one of these infections can transfer to thousands of people very quickly. So we are hopeful that this helps reduce the spread of this mutation, and I'm glad we've been able to take this action. Your second question I promptly forgot. Now, what was your second question? I'm sorry.
Is there an estimate on how long this order will be in effect?
No, it isn't. We don't have an estimate at the moment, and we've acted fairly quickly because we have found that, if you're behind this virus, it's just too late. So this is what science tells us, and we're following science as quickly as we can.
Next question comes from Tom with Northwest News Network.
Thank you, Governor. Can you talk a little bit about whether there was coordination with other states or the federal government on this quarantine order, and to what extent you explored perhaps just forbidding incoming flights from London?
Well, we have not had a chance to coordinate with other jurisdictions. The time was more important to act at this moment. We'll see what other states and the national government does. Sometimes we've done things and other states have followed. We'll see if that's the case. It would be helpful if they did, obviously, to prevent folks from flying into Portland or San Francisco and then driving here. So we hope that's the case, but it's not necessary to effectuate what we're trying to do here. So we did have the ability to act alone in regard to the science. We do not have the authority to prohibit flights into the state of Washington. That remains in the purview of the federal government. So we do not have the authority to do that. We'll see. The federal government apparently at the moment has decided not to make decisions in this regard. But we'll see. We do know that a number of countries have prohibited flights from the UK in Europe. And I can just say, look, these are difficult decisions to interrupt people's holiday plans. We don't do this lightly. But we have to understand that the cataclysmic results of having people come here who are infected, we've now seen what can happen. And this is a mutation that there is much that is not known at this moment. As Dr. Bedford suggested, we don't know that this is either more infectious or more with any certainty regarding transmission, although it certainly looks at least highly probable given the explosion in the UK. But you can't wait, a year for scientific certainty. This is the right decision given the enormous consequences for inaction.
Next question comes from Joey with the Everett Herald.
Hi, Governor. I hope this is on topic enough. But, this seems to be, we've got so much good vaccine news coming in the COVID pandemic, and this seems to be another harsh reality that the state has to deal with. How do you think this announcement, is going to affect folks and their mindsets going forward into a holiday season where COVID rates are still pretty high across the state?
Well, I think it'll be individual. People, react differently. Look, reality is a tough thing to deal with. It certainly is at this moment. But, if we look 2 months down the road and this mutation hit it is so hard, we had thousands of people getting hit by a mutation that, could be worse than the current version, and looked back and said we didn't act because we just wanted people to feel the holly jolly spirit, we would not feel very good about that. So we had to act. It is the right thing from a public health perspective. I do want to say this, though, on a bit of a personal comment, if I can. I had a delightful FaceTime discussion with my granddaughter who just turned 1 the other day and her parents. And I have to tell you, I'm as filled with the holiday spirit, knowing she's healthy and I'm going to keep her healthy, and they'll keep me healthy and my wife. That's pretty good holiday spirit, too. And I hope people will find a way to feel that joy that is unique to this season of many different faiths. There's no reason we can't have that inner warmth in our hearts for our loved ones, even though we're avoiding a lot of these indoor gatherings. I know we can do that. I know we can share that music, which I still like. We listened to Elvis Presley singing this morning when Trudy and I woke up. So singing a Christmas tune, of course. So I'm hoping people don't let this diminish the holiday. It's just a reminder of how love can keep us healthy, and I hope it does.
Next question comes from Police with King 5.
Hi, Governor.
Hello.
You can hear me okay?
Yes, I
Governor?
can. Yes, I can.
Okay, hi. Okay, hi, I'm Parise Thomas. This question is, this is about the legal requirement. You said quarantining is a legal requirement, but a little early on you also said that we don't have the ability to take people into custody. And so I look at places like New York where they have people waiting for you when you get off of your flight when you arrive, and you're filling out paperwork, or Hawaii where they're taking people to jail or they're taking them into custody. So what happens if a person is found to have defied that order and does not quarantine for 14 days?
Well, at the moment, what happens is if people lose their lives, that person feels terrible. Terrible if your irresponsibility results in the loss of life. And that's what happens if people don't respond responsibly. That's a sanction of a large sort. Now, we could adopt additional logistical ways to greet people when they leave. That could happen when they leave the airport. That could happen. We are exploring ways to communicate this requirement to passengers right now, talking to the airlines, asking for their assistance, and potentially the Port of Seattle. So we will have some discussions about the logistics, but we needed to get this in place today before the cat was, out of the bag or the horse was out of the barn. And that's why we had to act today. We will consider some of those logistics of notifying people so we can communicate with them to encourage their compliance in the upcoming days.
Next question comes from Nicole with Cairo Radio.
Hi, Governor. Going on that logistics point, is there a way of checking at the airports if people are coming from the UK or South Africa, but perhaps changed planes in another state so they appear to be flying domestically? For instance, I don't believe SeaTac does direct flights to South Africa. If somebody changed in JFK or in LAX, would there be a way of checking where they originally came from so that they could be given those recommendations?
Well, yes, we're exploring logistically how to do that. We hope all the airlines will cooperate with us to help give information about this quarantine requirement to all the passengers coming in on international flights. If they can't target the folks who have stopped in the UK, if they can, then we will work with the airlines to ask them to help us give notice of this quarantine if the airlines know that person has been in the UK or South Africa. And they do have that information, at least when there's brief layovers. So we'll work with them. We've had good cooperation with the airlines so far. I hope that they will cooperate to get the notice to them as quickly as we can.
We have time for 2 more questions. Next comes from Keith with Como 4.
Governor, how is this going to work? Are you going to have 2 weeks of quarantine and then get tested? Or how can you get tested if you're in quarantine? And what about the people who are flying in to be with family for the holidays? Can they quarantine with their families?
Well, no, not if you're indoors with people that are not in your pod. That's not quarantining. And that's that's why we've given thought to this. But this is a public health emergency. The public health is in great danger. We're dealing with a mutated virus of unknown dimensions. It has already caused huge spikes in the transmission, apparently in UK, which has necessitated them shutting down significant activity. And that means that we're going to have some quarantine of these folks. And now how they get tested, I'm sure there's a way to get tested. You can get to a testing facility and still not break a quarantine. You can certainly do that. And we do encouraging people to get tested during this quarantine period, even if you are asymptomatic, because it gives us surveillance of what the disease is doing or not doing. We can find out if this mutated strain has arrived, and that'll be very helpful.
Next question comes from Lachey with Tattoo News.
Hi, good afternoon. I just was hoping to check with health officials to see how they're seeing if this variant is showing up within the state. And I was also hoping if DHS is on the line, if they could provide us with some information why long-term care residents aren't getting the vaccine this week.
Scott, do you want to talk, or Trevor, about whether it's in the state or not?
Yeah, and so we have an existing surveillance system within the state where positive results get sent to get genotyped to see what strain changes. And our national expert is actually Trevor Bedford. And fortunately, we've been working with him since the very first case of COVID here in Washington State. So that will continue. We are talking of ways to see what the prevalence of this new strain is, and we get it. But again, like the governor said, we're really encouraging any of these travelers to get tested, certainly when they're symptomatic, but even if they want to test, to help us gather data to make sure we're not getting this strain here in Washington State. So Trevor, is there anything else you would add to that, to our ongoing infrastructure for detecting this?
Nothing in particular. So the U.S. as a whole is sequencing viruses. Washington State is doing a particularly good job at sequencing viruses out of the U.S. And of all of the 1,150 genomes that have been sequenced from the U.S. since November 1st, none of them have been this variant. So we haven't found it in anything that we've looked at so far. However, we will be endeavoring to kind of sequence as deeply as possible to be looking for it in the coming days and coming weeks.
Yeah, the question about the long-term care facilities is this is just a matter as the supplies come in. Not everyone will get vaccinated on the first day. So it looks like the supply chain is intact. There is no indication that the production of the vaccines has been delayed in any meaningful sense. The glitch that occurred because the federal government did not give us accurate numbers about what would be coming in this next week, was a one-time event. So all systems are go at the moment, and obviously we're thrilled with the arrival of the Moderna product. So everything's moving forward, but it can't all happen in the first day for everyone. And by the way, coming back to this question about enforcement and sanctions, we have found that when we have put legally binding requirements in the state, we have had incredible levels of compliance. The vast, vast majority of Washingtonians are pitching in. They are masking up. Businesses are following these difficult restrictions. And that's why our state is doing so well relative to other states. Look, we have saved literally thousands of people throughout this pandemic. We would have lost thousands of more Washingtonians had we not followed those legal requirements. So the good news is Washingtonians want to save lives. We understand science, and we're doing well. We just got to keep it up. This is one of the more things we need to do involving people coming in from the UK.
We have time for a follow-up from David with the Seattle Times.
Yeah, just on something Dr. Bedford just said, when you said there's 1,150 genomes that have been sequenced since November 1st in the U.S., so would you describe that as there's 1,150 different variations or 1,150 different mutations? What exactly?
I see.
How exactly would you describe that for kind of a lay person and what it means?
So that's 1,150 different infections, different people with coronavirus who had their nose swabbed, and then the virus that was infecting them, that genome sequenced. Most of those will likely be slightly different from each other because of the virus is mutating all the time, and most of the mutations really don't do much. And so we have eyes on these 1,150 individual infections, and 0 of them are the new variant, and from either the UK variant or the South African variant. That is still only 1,150 out of 200,000 cases that are reported nationally every day. So it's possible that it's circulating at low level and we just haven't seen it yet, but we have yet kind of 0 evidence of it actually circulating.
Any final words, Governor?
No, I want to thank everyone. I hope people experience joy this season, and one of those joys is keeping people alive. And if people follow this quarantine, we had a good chance to keep more people living the next holiday season. So I'm looking forward to that. Be safe. We'll answer some more questions in the next day or so. Thank you very much. Take care.